2022. Thank you very much. We're now going on to the 10-minute rule motion. Bob Blackman.
Thank you, Mr Deputy Speaker. And I beg to move that leave be given to bring in a bill to make provision about the sale by retail of tobacco and related goods and for connected purposes. Now, Mr Deputy Speaker, in the backbench business debate last week, my honourable friend the Minister, who I see is in his place, restated the government's commitment to making England smoke-free by 2030. However, as the Minister knows, we're not on track. Indeed, according to the most up-to-date data on smoking prevalence published by the University of College London, smoking rates have flattened since 2020. And if the government is serious about achieving a smoke-free 2030, then the status quo is not sufficient. So ratcheting up regulations and closing loopholes is crucial to any serious plan to support smokers to quit and to prevent young people from starting to smoke. So requiring tobacco retailers to be licensed to sell tobacco would be a major step forward. It's not just my view, Mr Deputy Speaker, it's also the view of Javed Khan OBE, who recommended tobacco retail licensing in his recent independent review of smoke-free 2030 policies earlier this year. Now, it's long been the case that to sell alcohol in England, retailers must possess a licence, which is registered with their local authority. If a retailer breaks the conditions of the licence, for example, by selling alcohol to someone aged under 18, their licence can be revoked, preventing them from selling alcohol legally and depriving them of revenue. Now, this is crucial in helping reducing underage sales as well as preventing the vast majority of law-abiding retailers from being undercut by an irresponsible few. Now, cigarettes, which are much more harmful and addictive than alcohol, require no such licence. Smoking killed around 78,000 people in England in 2020, while alcohol was directly responsible for around 7,000 deaths. Now, two-thirds of those who try just one cigarette go on to become addicted daily smokers, and the vast majority of those dying from smoking each year were addicted as children. The latest ASH survey found that 60% of child smokers buy their cigarettes from shops, yet there's no requirement for retailers to have a licence to sell tobacco which kills its users. So this bill would rectify that egregious gap in the regulation of retailers. This was an important recommendation in Javed Khan's independent review into making smoking obsolete. He recommended that a retail licensing scheme should be rolled out nationally and administered by local authorities. The cost of the licence should be determined by each local authority with a national minimum set. He recommended that criminal retailers who break the regulations or fail to carry out age verification should lose their tobacco licence for their premises. Any loopholes for transferring licences to new names or to alternative premises should be closed. So selling tobacco without a licence must be an offence attracting heavy financial premises. And the local authorities must also be able to attach public health criteria to the licence. For example, prohibiting sales near schools, requiring the sale of less harmful alternatives, and displaying stop smoking advice on retail premises.